When you grab a snack or a bottle of medicine from the shelf, you just trust that it's safe. But have you ever really stopped to think about who makes sure of that? Well, today we're going to dive into a landmark law in the Philippines that acts as a powerful and often invisible guardian for your health. Let's get right into it. It's a question that affects all of us, every single day, right? The answer involves a pretty powerful system working behind the scenes. It's a specific law and a dedicated agency with one critical mission: to make sure the products we all use are effective and, most importantly, safe. So, 2009 was a huge turning point. The government basically realized that the old system just wasn't cutting it anymore for a modern, growing country. It was time to give our public health protectors some serious new tools and a whole lot more authority. And it all started with a simple name change. But trust me, this was way more than just new lettering on a sign. It signaled a massive shift in both power and purpose. Okay, so before 2009, we had the Bureau of Food and Drugs, or BFA. But this new law, Republic Act 9711, transformed it into the Food and Drug Administration, the FDA. Now, this wasn't just rebranding. It was a complete change in philosophy. You see, shifting from a reactive bureau to a proactive administration meant it was no longer just about responding to problems after they happened. It was about actively managing public health and getting ahead of threats with real regulatory muscle. And make no mistake, this was totally intentional. The whole point of the law was crystal clear. Congress wanted to beef up and streamline the agency, creating a much more effective and powerful body to protect the health of every single Filipino. So, what did this upgrade actually look like in practice? Well, the law didn't just give the FDA a new name, it gave it a whole new toolkit, packed with serious powers and responsibilities. This is basically the FDA's day job, the day-to-day grind of keeping us safe. They're responsible for everything from showing up and inspecting factories to licensing companies so they can operate, and constantly testing the products that are already on our shelves to make sure they're up to standard. And what happens when things go wrong? Well, this is where the rubber meets the road. The FDA has a clear, powerful process. They can test a suspicious product, immediately order a company to stop selling it, force a nationwide recall to pull it from all the shelves, seize the dangerous goods, and then hit the violators with some major fines. This is enforcement with serious teeth. And if you're wondering where they get that kind of power, well, it's written right into the law, black and white. The FDA has the ultimate authority to act, and act decisively when a product is proven to be dangerous. It's a life-saving power, and it's at the very heart of what they do. Okay, so we've seen the how, but what about the what? You might be surprised by just how many products fall under the FDA's watch. The range is, well, it's huge. The law uses this really broad term, health products, and it covers so much more than you might think. We're talking food and drugs, of course, but also cosmetics, medical devices in hospitals, vaccines, and even potentially hazardous stuff you might have under your kitchen sink. It's a massive scope. Now, you might be wondering, how on earth do they manage all of this? They did it by structuring the FDA into specialized centers. This makes sure that you have drug experts regulating drugs and food experts regulating food, and so on. It's a really smart, focused approach that ensures every product gets the expert oversight it needs. All right, so a law is only as strong as its rules, and more importantly, the consequences for breaking them. So let's look at what the FDA Act says is strictly off limits. The law lays out a very clear list of no-nos. Basically, you can't sell stuff that hasn't been approved by the FDA. You can't lie on the label or mess with the product itself. Tampering with labels is illegal, selling expired goods is a big one, and you can't even run a health-related business without getting a license first. These are the red lines you just don't cross. And yeah, if you cross those lines, the consequences are serious. We are not talking about a slap on the wrist here. The Act made sure the penalties would be a real deterrent. How serious? Well, for starters, violators can face actual jail time, up to a decade behind bars. The message is pretty clear. If you put public health at risk, you're going to be held accountable. And for the big players, the manufacturers, the importers, the distributors, the fines can go as high as 5 million pesos. Now that is a powerful financial reason to play by the rules and put consumer safety first. Okay, so we've gone through the details, the powers, the penalties, but let's take a step back. Why does this one law, this one act from 2009 matter so much? Because look, this wasn't just another piece of legislation. The FDA Act fundamentally changed the entire landscape of consumer protection in the Philippines. It built a framework that truly empowers an agency to proactively and forcefully protect the health of every single citizen. You can really boil its impact down to these three pillars of protection. First, it gave the agency way stronger enforcement powers. Second, it expanded the coverage to all kinds of new products. And third, it made it crystal clear who was accountable when something went wrong. These pillars hold up our entire public safety net. So at the end of the day, the FDA, empowered by this law, acts as our silent guardian. It's the reason you and I can have that extra bit of confidence in the things we buy and use every single day, working tirelessly behind the scenes to keep us safe. The FDA Act of 2009 was, without a doubt, a massive leap forward. But the world doesn't stand still. New products and new technologies are emerging all the time. And that leaves us with a really critical question for the future. How do we make sure our public health guardians can always keep pace? It's definitely something worth thinking about.